Coughing is a reflex action that helps protect and clear your airways. When there is an irritation or obstruction in your throat or lungs, nerves send a signal to your brain, triggering a cough. This reflex helps keep your lungs clear of mucus, often a result of infection, and removes irritants or foreign particles that you may have breathed in. There are two main types of coughs. A productive or wet cough brings up phlegm or mucus from your lungs. This helps clear your airways of excess secretions or substances like dust or smoke. An unproductive or dry cough doesn't produce mucus and is often the result of irritation or inflammation in the throat or lungs. When you cough, you first take a deep breath in to fill your lungs with air, then your epiglottis, the flap at the back of the throat, briefly closes off your windpipe. The stomach muscles then contract to build pressure. Air from your lungs is then forcefully expelled through your vocal cords, causing the characteristic coughing sound. The high speed of the expelled air helps dislodge and expel mucus or irritants from your airways. Coughing can be triggered voluntarily, but more often happens automatically when your airways detect an irritation. While coughing may be uncomfortable, it's an important protective reflex that keeps your respiratory system clear. A spinal cord injury can significantly impair the body's ability to cough effectively. This is because coughing requires coordinated muscle contraction and strength that may be disrupted by a spinal cord injury. Injuries above the thoracic level 12 often weaken or paralyze chest and abdominal muscles, making it difficult to generate the force needed to cough. Without proper and productive coughing, mucus can accumulate in the lungs, increasing the risk of pneumonia and other complications. So various assisted cough techniques and devices may be needed to help clear secretions after a spinal cord injury. For people with a spinal cord injury, working with a respiratory therapist and learning the breath stacking and assisted cough techniques is often essential for maintaining lung volume. Breath stacking and assisted cough, or BSAC, is an airway clearance technique which can be used by people with weakened respiratory muscles. People living with neuromuscular diseases or spinal cord injuries can often benefit from using the breath stacking and assisted cough technique. Breath stacking involves taking several small, consecutive breaths without exhaling in between. This allows more air to accumulate in the lungs, stretching the lungs, and naturally stimulating a productive cough. A respiratory therapist or caregiver provides coaching and assistance to stack up to 3 to 5 quick breaths using a mouthpiece or mask connected to a resuscitator bag or volume ventilator, also known as a lung volume recruitment device, or LVR. Assisted cough, used in conjunction with breath stacking, helps manually induce coughing when a person's own cough is inadequate to clear secretions. To perform it, the therapist or caregiver applies a thrust to the abdomen or rib cage in an inward and upward motion after the person takes a big breath in and is just about to cough. The thrust must be started just before the person releases their air. The thrust is timed just before the person coughs to build pressure and increase the speed of air during the cough. This coordinated action mimics the body's natural cough mechanism, generating shear forces to enhance clearance of mucus. Proper training is essential to ensure assisted cough is done safely and effectively. Using these airway clearance techniques helps maintain lung function over time for those with weak respiratory and stomach muscles. Using the combination of breath stacking and assisted cough techniques can help. Keep your lungs clear of infection. Keep the air sacs in your lungs open. Keep your chest wall flexible. This allows you to take bigger breaths on your own. Keep your lungs clear of mucus plugs. Mucus plugs are very thick secretions that can get stuck in your lungs and airways. These can prevent you from getting enough air to breathe. Improve your ability to cough without thinking about it. Increase the amount of air your lungs can hold. Improve your body's oxygen levels. And even help increase the strength of your voice. If you think the breath stacking and assisted cough techniques are something you could benefit from, connect with your healthcare team to discuss lung volume testing and how to get the tools and assistance you'll need to get started. To learn how the breath stacking and assisted cough techniques are done, be sure to watch the demonstration videos in this series.